Okay, thanks, Anna. Let's go ahead and begin. Welcome, everybody. ESA, I know I speak for Cindy, Anna, and myself, and how much we appreciate you taking time to be part of this really exciting healthcare series focused on well-being, which will continue into October. This is the 5th of 8 meetings set at a 2-week interval, where we have been showcasing to our community the best of the best innovations in well-being that are positively impacting organizations as they focus on attracting, engaging, and retaining talent. Before I turn it over to Art, our session leader, and to introduce Castlight Health and Omada Health, we always want to acknowledge and thank our sponsors, certainly ADP and Siegel, and of course, Art, for your willingness to facilitate and moderate this discussion. We consider Art one of the innovators in the well-being space. He has been instrumental in targeting solution providers who are unique and some of the best. Art is the president and CEO of Top Gear Strategies, has been at the forefront of innovation for well over 4 decades, and his company advises on leading innovations and growth strategies. So with that, I will turn it over to Art to set the stage for our time together today and to introduce Castlight Health and Omada Health. So with that, Art, all yours. Thanks for being here. Much appreciated.
Thank you, John. I appreciate your introduction because it really emphasizes why employers like those on this call are doubling down on very new and innovative strategies, because they're really trying to achieve a threefold improvement, both behavioral health and financial well-being. And 2 of the best well-being and wellness companies are on today to present, both Castlight and Omada Health. Both are going to be available. I'm going to go to the slide where we talk about our speakers here next. First speaker is going to be Peter Hege. And Peter, we're glad you're here today. He's the general manager and basically the one who is going to be talking to us about Castlight Health. And by the way, congratulations. I understand that you guys are now not only a merger partner, but also integrating with, oddly enough, the other presenter today, which is Omada Health. So we're looking forward to hearing the symbiotic relationship that both organizations presenting today are going to bring to their customer base. So as I told everyone on this call, this is going to be recorded today, like John said, I should say. And why are we doing this? I think John's already hit that nail on the head. So let's kick off the first session here with Peter in just a moment. I want to make sure that you all know to stick around for part 2. That's going to be led by Gabriel after Peter presents. And since we've already sort of giving you a bit of a spoiler alert that both presenters today have actually completed the merger and are integrating with each other, this is going to be particularly interesting for the second half of this presentation. So please stick around for that second half. Peter, we're extremely delighted to have you on our panel today, and I would like to let you know that in just a moment we're going to have you turn on your screen, but I also want to introduce Gabriel. Gabriel is the National VP of Sales of Omada Health, and we're glad you're here today. Again, Gabriel, or Gabe, as we like to call you, we've talked about how you guys have been a unique merger or relationship with one another. So I'm anxious to hear during today's session how that's going, how it is being received, and some of the many benefits that large employers are gaining to engage and retain their workforce. So Peter, can you go ahead and share your screen? You're going to have 15 minutes, and thereafter we'll give you 10 minutes Q&A, and I will need to cut you off 15 minutes sharp. So you can begin now. You have 15 minutes.
All right. Can you hear me okay, everybody? Thumbs
Yes.
up. All right. Well, Art and the Executive Strategic Alliance, so great to be with you today. And Gabe, it's fun. It's fun to have a partner on the call that we have a deep ecosystem relationship with. So the title of today is really, if you really want different results with your well-being program, it requires a different approach. Castlight Health has been on a mission for the past 14 years to make it as easy as humanly possible for employees to navigate healthcare and live happier, healthier, more productive lives. Ultimately, our goal is to do 3 things: one, simplify healthcare and benefit navigation for your people. Two, help keep your population healthier and out of the healthcare system to help you drive down the total cost of care. And then lastly, make HR leaders and your benefit teams more effective by driving the outcomes that are most important to you. I wanted to start off by sharing four employee stories that I hopefully will sound familiar. Let me talk a little bit. Do you have a Gloria in your organization? Gloria is one of your key technical leads. She's a mom of three. Her 14-year-old daughter was at volleyball practice, hurts her hand. She's called out of work. When she picks up her daughter, pretty quickly the hand starts to turn numb. The mom, very concerned, immediately not knowing where to turn, takes her to the ER, where they spend the next several hours, wrap up huge bills, and ultimately, turns out that it's just a sprain, and really could have avoided an ER visit. Several weeks later, Gloria and her husband receive a bill for over $5,000, totally unexpected. That more than that hits your pocketbooks on your health plan. Stories like this happen time and time again. Frank is one of your rising stars. He's been concerned with a strange dark mark under a nail. He really feels like he needs to go get it checked out, but it's just been too busy. He finally gets around about 2 weeks later to searching out a primary care physician, goes online to schedule an appointment, and needs his health insurance information. Doesn't have it available and just says, well, I'll do it later. Well, doing it later, turns out he doesn't actually reach out to a primary care physician for a month later. It then takes him 2 months to actually get a new patient appointment. By that point, the physician's very concerned about what's going on underneath his nail, refers him to a dermatologist. 2 months later, he's diagnosed with melanoma. Again, wouldn't it have been great if we could have caught that 5 months earlier. Lisa is the wife of one of your regional managers. Your regional manager has unexpectedly, several weeks ago, had a stroke. He's just being released from the hospital, but he hasn't given very good follow-up instructions. Lisa's at her wit's end, trying to take care of her husband. Your benefit plans offer some great benefits that could help her both take care of her husband at home and also with follow-up visits, but she has no idea that those are available to her. And as a result, her husband is out of work 3 months longer than he should, forcing you and your teams to scramble to fill in for this key leader. And then lastly, Henry, he's a dad, has a single daughter in her early 20s. He is at the moment very distressed because his daughter has just had been placed in inpatient psychiatric care for a suicide attempt. He and his wife have never dealt with something like this. They're feeling lost. Your benefit program has a lot of great behavioral health, mental health options that are unaware to him. As a result, he remains completely distracted dealing with this traumatic event, and ultimately, does not get the care for himself, his wife, and his daughter that he needs. So unfortunately, time and time again, these are the stories facing our populations. There continues to be low health literacy, people knowing where to go. Unfortunately, water cooler talk in terms of that's how we pick doctors, whether it be through friends and family, colleagues at work. And as we all know, healthcare spend starts when we pick a doctor. The networks they're a part of, the referrals, the types of procedures they do, the referral, the healthcare systems they're a part of. So just doing willy-nilly chance of word of mouth and not using data to help those decisions is driving lower quality of care and increased cost of your health plans. And then lastly, there just remains unnecessary barriers to care. Like I mentioned with Frank, he got stuck in a bit of mud. There's no reason why he should have waited 5 months to get that diagnosis of melanoma when we could have caught it earlier. And then lastly, when are these challenges, and like many employers, you offer great benefits, but many times they go underutilized or in worst case unutilized due to they don't know about them. They don't think about their benefits till they really need it. And wouldn't it be great if we could actually serve up the right benefit at the right time when an employee and his or her family really need it? So to solve this, ultimately, healthcare is an immensely intimate and personal journey. It needs to be an N-of-1 experience for your people, and to drive the impact and outcomes that both you and your employees need and want. We need a simplified, engaging experience that is clinically relevant every time to every member. And also, we need to meet members where they are. We're in an age where we all carry around our smartphone. We need to give employees the ability to digitally self-service when they want it, but also the ability to reach out to expert human guidance when they really need it. And that's exactly what we've done to solve these multiple problems facing your populations, is to create a single front door digital experience to meet employees on their terms, giving them a person-centered health and well-being navigation experience that takes your disparate, amazing offering of benefits and puts them into a platform that gives me, Art, John, Anna, a personalized benefit healthcare well-being navigation experience that serves up the benefits that are most relevant to us based on our unique needs. We ingest healthcare claims from your carriers, both your medical, dental, RX, as well as health assessments from your members, health goals, to serve up to guide them to most relevant programs within your benefit offering, but also the most relevant care when they need it. We pair that with a team of expert guides that we call care guides, that are both, I call them benefit ninjas. On one hand, they're experts in your benefit plan, but also we have a team of clinical nurses that help give employees peace of mind that they're making the right decision when they're dealing with a chronic, serious medical condition. Our platform itself, we're the only platform in the industry that combines these four elements: really expert guidance to care. So when folks need to seek the healthcare system, a whole holistic well-being, mental, physical, emotional, to keep folks healthier and out of the healthcare system, a integrated ecosystem of which Omada, which you'll learn about in a minute, is a part, that allows us to deeply connect to your most valuable programs. And then we pair that with a team of clinical advocates called care guides to bring it all together. Ultimately, all this is great, but it doesn't work unless we can engage employees. And so our platform, we've done the hard work over the past 14 years to create really a platform that works 24/7, 365 days a year, to proactively engage employees in the right programs, benefits, and care through push notifications to their smartphone, through outbound smart emails that are categorized based on the employee's unique conditions, claims, and needs, direct mail when need be to those hard to reach populations, secure chat with our expert care guides, and then obviously the ability to get on the phone with an expert if and when needed. What we found is to really drive the engagement of the full population, not just the healthy and not just the sick. You need an integrated, holistic well-being solution in your platform. One that helps to encourage physical activities through step challenges and they daily get active alerts. Integrations into your emotional and social well-being programs, as well as financial retirement programs and health savings account. And then lastly, giving you key tools to help to achieve better health equity and reach those targeted, more vulnerable populations when they really need it. And the ultimate goal of the well-being platform is, again, to keep folks out of the healthcare system. But when they do need to access the healthcare system, we need to give them expert guidance driven by not cooler talk opinions by friends, family, and coworkers, but actually driven by data that knows the actual quality of care of a particular provider, data that actually knows that a provider does the procedure that the employee needs, and lastly, really knows the cost of care. Healthcare is probably the only industry in the U.S. or in the world where there's no correlation between cost and quality of care. So you can get very high quality, very expensive care, or you can get very high quality, cost-effective care. You have to have the data, which Castlight drives behind the scenes to make that happen. And with that, our platform uses the unique insights that we have on each member to connect them to your high value programs, steer them in the moment to those key high value providers, educating them to be able to search for key conditions when they have a question, and lastly, guiding them to key well-being tools. All of this is based on evidence-based guidelines, and you can see some of the key guidelines that we follow at the bottom of this slide. And then lastly, what we've done is we were a pioneer in really connecting this fragmented benefit ecosystem. This is a view of our 30+ integrated partners across personal well-being, condition management, and lifestyle tracking. We believe that you need a two-way data exchange so that it's not just sending members into the point solution stratosphere. And when we are actually able to connect these best-in-class vendors to a healthcare navigation platform, we see some amazing results. So looking across several of our diabetes partners, behavioral health and MSK, on average, when these providers try to engage members on your members on their own, they see anywhere between 15 to 20% engagement. When they're connected to a healthcare navigation solution like Castlight, we see those engagement rates increase by 2 to 4x. And you can see that when we do that, there's significant savings to be had by using these high value programs. Lastly, as I mentioned at the start, we need to meet members on their terms. We have a team of clinical advocates and benefit ninjas that know your plan inside and out. Ultimately, they're meant to do these 6 things: to give your people the peace of mind that they're making the right decision, going to the right doctor, paying a fair price for care. 2, productivity boosters. Our philosophy is like, give us your healthcare homework, whether it be problematic bill reviews, finding a right doctor, scheduling appointment. That's our job. Let your team focus on the job at hand and taking care of their families and their personal lives. Enabling high quality care. Again, I mentioned healthcare care starts when you choose a provider. So let's get folks to the right provider at the right time from the start. And then being an extender of your team, to be really a resource to push a work off your desks to our team so you can focus on the more strategic work. And then lastly, to drive unprecedented results in your health plan and well-being plans. Our DNA of our team is unique. We like to say we have heart, empathy, and grit. Tilly on the right often says that if you're part of our team, you have to care. We're called care guides after all. You have to care about the member, what's going on with their family, what's going on with their work life, what may be going on in their home. You have to care about the care guide but next to you, because you may need his or her help to help solve the problem for your people. Empathy, there's a difference in listening and hearing. We actually hear by asking questions, asking questions to unearth the question behind the question. And lastly, grit, one of our key mantras is, it's no longer your problem when it comes across that chat or that email. It's our problem. We're in this together, and we will work together to resolve your issue as quickly and fully as possible. When we do this, we see amazing results. We see Castlight users 30% less likely to have a gap in care. We see anywhere between 1.6 to 1.9 increases in the likelihood of folks to complete key well-being and cancer screenings. And when we pair that with a high-touch experience to a care guide, we see all these values multiplied by 1.5. And lastly, you bring this all together, with a platform that can engage every employee, the healthy and the sick, one that can guide your people to the care that they need, one that helps you unleash the true value of the amazing ecosystem partners that you have in your benefit program, and a platform that actually helps you drive the outcomes you care about, and not just creating a nice to have experience. We see amazing engagement, over 2/3 on average, platform registration, a 57% monthly return rate. We see an exceptional +83 best-in-class member experience from a net promoter standpoint. We see a 55% increase in critical programs, and we see employers like you bend their healthcare cost curve 1.5 to 3.2%. And just to close it out where we started, just to tell you, to finish out the story, Henry was actually a Castlight member. It was a case that came across our care guides last week. His story, like I mentioned, his daughter had a suicide attempt. He was distraught, did not know where to turn. He turned to our team to say, really first, how do I pay for this? Does my employer cover this? we were able to actually, hey, here's how it will be covered. Here's what your expenses will be. Here's what your employer will pay for. But hey, how are you and your wife doing? Are you taking care of yourself? Do you know that you have resources through your employer to actually where you could seek care? He said, you know what? That's nice. I'll think about it. But I think I'm okay. Our team followed up
Peter,
with information.
I'm sorry. I'm going to need to stop you because we're through our 15-minute window. I want to make
Okay.
sure we have plenty of time for Q&A.
Sure.
Would you mind stopping your screen share so we can see the attendees as they ask questions? And sorry to cut you off, but we just want
Yeah, no problem, Art.
No problem. Good content. Thank you for that presentation. So we just want to remind everybody on the webinar that you can click the raised hand feature if you'd like to speak through your browser, or you can type your questions into the chat function and we'll ask them for you, as many as we have time for. So I see we have a bunch of questions coming in already. I want to take the first one. So I'm a company that has a human capital management system that has a front door in it. I've got Workday, I've got ADP. So how does all this technology work with that?
Yeah, so we obviously we work with many of the Fortune 500, if not Fortune 50. Really, it's really a strategy we'll work on together. A lot of folks, what we'll do is, whether it's a benefit administration platform, as part of the registration for benefits, one of the required signups will be to register for Castlight. Whether it be if it's like ADP or Workday, a lot of times we'll link out from there. But ultimately, where we want, what we find most of our employer clients, they want Castlight to be the front door when folks are navigating their well-being and navigating their healthcare experience. And so we really leverage those key, those HR platforms to drive engagement early on into the platform, so they have the app in their pocket if and when they need it. Great.
So I saw a lot of iPhone type images on there, but I'm a truck driver and I use a flip phone. And so, I've got Castlight. I don't know how I want to get access to all this technology because I just don't use it. So how do you serve that member when they're traveling?
Yeah, Art. So great question. One of our philosophies is meet members on their terms. That's why we truly believe that if you're going to invest in a healthcare navigation platform, you need one that gives the folks that want digital self-service that option when they need it. For that truck driver, the ability to call in and talk to an expert. That's where our care guide team comes in. The ability to we'll be sending that truck driver an email, or the ability to put that number in his or her phone, a 1-800 number that will go to a specific group of advocates that serve that population and are experts in not only their company's benefits, but experts in their health, their health plan, their RX plan, their dental plan, and their vision plan, and to really help them guide them if and when they need care into the system.
Can you speak to anything you're doing regarding AI or machine learning to predict potential future events and head them off in the care journey much earlier upstream?
Yeah, that's really Castlight was one of the early pioneers to bring a data-driven approach to healthcare navigation. We have a team of several hundred R&D folks. We have this engine that we create that is really, we ingest claims data from all of your carriers. We ingest health goals from the member, anything from the health assessment, their interactions with the system. All of this drives the AI learning experience to serve up behind the scenes. Every member has their own well-being plan. So if I'm at risk of diabetes, I will have a whole plan behind the scenes that's going to guide me to the appropriate programs, providers, and care that I need to keep that in check. If I've said, hey, I'm a little bit stressed out, or I'm feeling a little bit down, that puts me into a well-being, behavioral health, mental health, well-being journey behind the scenes. So all of us may have one to many journeys that are driving the experience behind the scene, all of which is being driven by amazing artificial intelligence and machine learning and rules that our team has created.
Great. Is there anything else you do to help make people like Frank get timely information? Frank's on the road. He hasn't called you yet. So, and you just talked about some of the data inputs for ingestion to be able to make predictions. So how do you get Frank engaged when Frank's not calling you and he's got a flip phone?
Yeah, so great question, Art. So a couple ways we do that. So one of our best in class practices is to ingest 2 years of claims data into the platform when we launch. As a result, that allows us to classify every member and understand potential either current health risk, where they are in the risk spectrum from low risk to rising risk to extremely high risk. And so for, let's say, Frank, he's a truck driver. Let's say he's in the rising risk category. And let's say collectively together, it's like, hey, Frank and his counterparts, they're not engaging with a smartphone. What we will do is our team of care guys can do outbound outreaches. We'll actually do one of our most effective mechanisms for outreach is SMS text. We have SMS campaigns that have a 99% open rate, and actually over 50% of our care guide cases come from those SMS texts that would actually go to a flip phone like Frank has.
Gotcha. Is there any limitations around benefits that could be loaded onto your platform, such as disability, absence management?
There is not. Yeah, really. You saw the ecosystem slide, and we have a lot of pre-wired deep integrations with partners like Omada. But let's say you have a one-off program that you've developed internally or that you have through your carrier. Really, our goal is to take your benefits and bring it alive by this N-of-1 experience, so that your experience is going to be very different than my experience based on what we know about you, what benefits you have. Let's say you're a salaried employee. I'm a blue collar hourly employee. I may not have the same benefits as you, but my experience is going to serve up the benefits that are relevant to me, just as it is for you.
And what about target size or minimum employer size to have your program in place?
Yeah, we typically, 2,000 or above is typically, but depending on the need, and we're willing to go a little bit smaller, but given the data feeds and other things, typically a 2,000 life plus group is a better fit.
Any preferred carriers or carriers that it doesn't work with?
No, I mean, one of the things Castlight has done compared to some of the other players in this space is we've done the hard work over the past 14 years to create the data pipelines with all the major carriers. And so, that work is pre-wired, has been done on your behalf. And so really it's all about taking your data, making sure it's in the right format so we can turn it on as quickly as possible.
Great. So it sounds like you do the hard work to make it all work with the client's platform, whatever it might be, correct? How about a lot of claims for improvement? What about guarantees behind some of these for a client that makes the commitment to make sure they deliver on those promises?
Yeah, I think there's always, I like to say there's been a lot of false prophets over the years, folks that have promised a lot and haven't delivered on that. So we put our money where our mouth is. We'll put performance guarantees around registration, return, a monthly return usage rate, ROI guarantees. We'll even go if there's particular gaps in care measures that you care about. We'll put money at risk there. So ultimately, this is your platform for driving the outcomes that you care about, and let's keep each other accountable for driving those outcomes.
That's great. Well, thank you, Peter. I know you guys have been a first mover for a long time, starting with the transparency tools, my goodness, at least 10, 15 years ago. So thank you for your innovation in this space. So, all right, Gabriel, you're up next. Mr. Gabe,
all right.
Before I get you started, go ahead and turn your screen on, but I want to remind everybody else on the call to let our presenters know, or those of us at ESA, that you are interested in engaging with our presenters today for further conversation. So Gabe, go ahead, share your screen. You got 15 minutes, and you know the drill now. 10 minutes for Q&A. You can begin. You've got 15 minutes.
Sounds great. Thanks. And thanks, Peter, for that great intro. So what you're seeing here is a virtual map. We've been here 11 years in the market, one of the oldest digital health providers, over 1,800 clients and over 700,000 members. And since our inception, this is a running total of how many people have stepped on the Omada cell chip enabled digital scale, 140 million and counting. Every day, every second, someone's getting on that scale. Let's jump into the presentation here. So every year we go out and we ask our 1,800 plus clients and a lot of prospects and consultants, what are your top needs? These 9 elements are the ones we hear the most. For me, the most important one is the upper left-hand corner, which is helping your employees live healthier lives. That's why Castlight's here. That's why we're here. That's why carriers like United Healthcare and Blue Cross and Kaiser Permanente are here. We're all trying to solve for these rising medical costs. So when you think of our approach, to me, it starts with the reality that in the 21 years that I've personally been in the employee benefit space, almost all of those years between United Healthcare and Blue Cross, believe it or not one time with thousands of clients that I interacted with over 21 years of all sizes, small, large, jumbo accounts, did I ever hand over a rate decrease. Hey, congratulations, we're actually going to save you money. It's never happened in all those years. We can blame inpatient hospitalization, new life-saving drugs, new surgery procedures. They all have a factor. But one topic that is not talked about enough are comorbidities. The fact that the aging population has an immeasurable number of chronic conditions. In fact, on average, a third of Americans have 3 or more chronic conditions. You saw that slide that Peter put up with a lot of different digital health providers, almost all of them. In fact, there's 90,000 providers in the country. Almost all of them are single point solutions. So they're trying to solve for diabetes or hypertension or MSK, musculoskeletal conditions. But here's some reality. If the average individual living with diabetes, almost 70% of them also have hypertension. Almost 60% of those folks living with diabetes also have an MSK concern, and almost half of them also have a behavioral health concern. Many of these folks living with chronic conditions also have social determinants of health issues, such as maybe they live in a food desert, so they don't have access to quality groceries with produce nearby, or their community doesn't have sidewalks or parks to exercise in, or they can't afford the insulin, or quite simply, as a chronic condition person, they don't have the family or community infrastructure to help them in this very arduous journey. Certainly, a lot of folks have tried, right? They've added telemedicine solutions to get members closer to their PCPs. They've added, as I mentioned earlier, 90,000 digital health apps to try to create some fun gamification, notifications to keep you engaged in your health. These alternatives have failed for 3 reasons. First, while getting access to your PCP is good and works for basic elements like colds, coughs, ear infections, it doesn't work for chronic condition members. 2, while all the digital health apps are fun, the impersonal nature of those apps is the reason why members disengage. Humans, we need that human interaction, and none of those options are really dealing with those comorbidities that are out there. So where do we find ourselves? We find ourselves in this space between PCP visits where members are absolutely isolated. They don't have a clinical care team that they need regularly throughout week over week, keeping them on track with their diet and exercise and their insulin shots and their hypertension medication. They maybe have access to some apps, or as you saw in Peter's slide, many apps, multiple coaches, multiple devices, and somehow they got to figure that all out on their own and get that data back to their PCP. They get recommendations from these apps, but almost often they're generic. So this is where Omada comes in. We recognize that there's 4 core elements that are important in a successful journey for chronic condition member. The first is pairing that member with a dedicated care team. Here at Omada, every single Omada that walks in the door is assigned a dedicated coach plus a dedicated clinician, whether you're a diabetes clinical diabetic expert, a hypertension expert, a behavioral health expert, or a physical therapist. All of these folks are dedicated. This is really important because in our research, we have found that the #1 reason members disengage with these apps is because it's impersonal. Imagine having to retell your story, especially live on a video call, over and over again to new people. People don't like that. In fact, less than 1% of our members in 11 years actually wanted to talk to a live coach. That's why for us, the interaction in the space and in the environment is the most important part if they're paired with a dedicated care team, not just a coach, but a clinical care team. Second, every one of these members is asked to go on that app and enter their food and enter their steps. We don't count calories. Keto diets work for 3% of the population, but most folks, including people like me, we don't have the time or the patience to count calories or stay on a strict diet. So we just ask our members, enter how much you ate, what you ate, and what do you think is generally healthy or not. Our coaches then are taking information from these devices that I mentioned earlier on the map, These are cell chip enabled. Every member gets a scale. If they have diabetes, they get both a glucometer with unlimited test strips at no cost. They have the option of a continuous glucose monitor, which is the equivalent of 300 pinpricks per day and twice as much data to our care team than the glucometer. If you have hypertension, you'll get a blood pressure monitor. And if you have a musculoskeletal condition, through the app, we have video technology and virtual conversations with a physical therapist. All of this data is sent to that dedicated care team that I mentioned above. And it allows our dedicated care team to create weekly, customized, personalized plans for those individuals, whether it is food alternatives, exercise alternatives, or maybe it's just meeting them at the right time. We recognize that when you're on a diet or exercise and you have a chronic condition, things happen. You have loss in the family, maybe you lose your job. There's lots of things that can happen. And for us, it's about meeting that member where they're at in the right time, where the right message is. These three things combined, the dedicated care team, the devices, and the weekly interventions, it's what's leading to 250% best outcomes. And more importantly, a scenario where we're combining these four elements to lead to true behavioral change and outcomes. Outcomes that, as you see here on this screen, are leading to the best clinical outcomes in the market. A 1.4 point reduction in A1C levels, that's CDC best in class. A 9-point reduction in hypertension and 13.4 with systolic blood pressure is also best in class. But don't take our word for it. What you need to do is peel the onion. And if you look at the number of published medical reports we have 24 and counting. Our next closest competitor has 9. For us, this means clinical efficacy. So the care model in and of itself, we know it works, but we also understand, and I'm glad Castlight was here before us, it's about getting the members into the program. Your truck drivers, your factory. I love the question about the cell phones. I get asked that a lot. And here's what I would say. Prior to coming to Omada, when I was at Blue Cross, we launched Omada at 120 different clients. And many of those clients had factory workers that were non-English speakers. I personally went down to those factories because I wanted to see for myself the comment about, oh, my staff doesn't have cell phones. 9 times out of 10, more than 80% of the room raised their cell phones. So that's what Omada does. We work with our clients to create these customized campaigns that we know, whether it's emails or posters or direct mail, banner ads, are leading to twice as much enrollment as what we're seeing in the market. And if we have access to condition-owned data, when we integrate with your carrier, we see 30% greater lift in enrollment. So in summary, what does this all mean to you? With Omada, you're getting truly the only digital health provider in the market that combines diabetes prevention, type 1, type 2 diabetes management, hypertension, behavioral health, and musculoskeletal, all under one care team, one roof, one experience, and one clinical data repository that's allowing us, again, to achieve those clinical results that I said earlier. So I'll pause there and give even more time for questions.
All right, well, that's great. So 5 minutes early, Gabe, you were very efficient. So we want to go ahead and take your screen off, stop sharing your screen, and we'll just open this up to Q&A for the audience here. Again, reminder, you can go click on the raise hand feature, or you can put your questions in the chat function. So let's open it up to some questions. I see one already on there that apparently one of the CHOs in the ESA network hired somebody to do this and deliver personal care to their 25,000 employees. I would think that what you're doing might be a little bit better than 1 to 25,000. Can you talk about perhaps some of the ratios of care delivery per some unit of employees?
Yeah, that is a great question. So on average, each of our coaches is working with 240 members at any given time, what we call a cohort group. Not every member has all conditions, right? So our diabetes, that ratio is a little bit larger, hypertension spectrum is a little larger, but the coaches who's the quarterback for the clinical care team, it's a 1 to roughly 240 member ratio, which is pretty darn good if you look at the industry-wide metrics.
Certainly it is. I wanted to ask some of the other questions I asked too. Is there a minimum size employer?
Great question. So out of 1,800 employees, we have employer group clients that we have. Half of them are under 1,000 employees. Many of those under 500 employees. 2/3 of our employer groups are under 5,000 employees. And then the balance of them are between 5,000. And we have jumbo accounts like Costco, Disney, et cetera. But our wheel well really is in that under 5,000 space.
Yeah, any noteworthy national retail clients where you're having some success in besides Costco?
Yeah, absolutely. So American Eagle is another great example there in Pittsburgh. Obviously Costco is our biggest one, but we also have Ashley Furniture in Minnesota. From our last presentation I gave last week in Pittsburgh, we have 27 retail clients in this space.
Any national ones that might be in the large big box stores as clients?
So Costco's our biggest. We've certainly, Ashley Furniture is pretty large. American Eagle's pretty large. Those are probably our 3 largest retail clients.
Are you working with Walmart, for example?
Not yet. We're close. We're close to launching a pilot with them.
Gotcha. Great. So what I heard you saying is obviously you're a kind of a multi-chronic condition manager who is attending to several conditions for the workforce that they need high touch care, either whether it's digitally or through remote home monitoring between their PCP visit to keep them engaged and keep them managing their condition effectively.
Correct.
So you also talked about a lot of the results that you got there. Are you also providing similar kinds of performance guarantees associated with your services?
We are. So we put 100% of our fees at risk. And this is a really important point I'm going to make here. We do not charge on a per member per month basis. There's a handful of others of the 90,000 that also do this, but the vast majority of the folks in the market bill you for every one of your employees, whether they're using the service or not. In our case, because we're not a solution, we are a medical provider. So based on HIPAA and PHI standards, your employees first have to qualify for our program. And once they're in and they're engaging, they have to engage on average 3 times in the last 6 months for us to bill you as an employer group. And again, based on those clinical results we mentioned earlier, our performance guarantees say that if we do not meet those minimum clinical standards that we've set up there, we give you 100% of your money back.
Great. One of the questions that I wanted to ask, because this is the first time we've had 2 best of the best innovators actually got married in the process. So can you speak a little bit about the reason for the merger, the benefits that you're seeing or the benefits you expect to see, the synergy as a result of the combination?
Yeah, that's a great question. So, there was a time where whether you were a company like a Castlight or Virgin Pulse or carriers like Blue Cross and United Healthcare, where you had multiple single point solutions. You had 10 or 15 of the Omadas in your wheel well. Over time, what you're seeing is a decrease, and in some cases, a singular. So for example, for ESI, right, the largest pharmacy benefit administrator in the country, we are their exclusive cardio vendor. Cigna, same thing. Various Blues plans, Kaiser Permanente. In the case of Castlight, we're one of a small handful. In case of Virgin Pulse, we're again one of 2 on their cardio suite. So I say this because that partnership and that ability for us to integrate from a data and an enrollment file perspective and contracting and billing perspective makes it so much easier for the client. And over time, I think that 90,000 window is going to really shrink down to the best in class in the market. We just happen to be lucky enough to be in all 5 chronic conditions.
Great. I'm just going to ask you this question about the metrics that clients are most resonating around to determine successful implementation of Omada. What are they using in terms of their bragging rights that they're seeing the results that they hope to get?
Yeah, so there's 3 different metrics that we use, right? The first one is engagement. So, employer groups ask us, what % of my employee population are you going to get enrolled and how long are you going to keep them engaged? So for example, over a 2-year period of time on our cardio suite, which is the hypertension prevention and diabetes, half of those members stay in the app. If you start to shrink it down 6 months in, you're still at 78% are engaged. 12 months in, 72% are engaged and so forth. On our MSK side, because that's typically a shorter, unlike a chronic condition that you have to literally manage your entire life. On MSK, we have 92% engagement. That's one factor. The second factor is clinical results. Those are the stats that I said earlier, a 1.4 point reduction in A1C levels, a 9-point reduction in blood pressure. That's the second factor. And the third and final factor is customer satisfaction. And we are at 97% customer satisfaction across all 5 of our chronic conditions, both from a member satisfaction and a B2B employer satisfaction.
That's great. I think I heard you say earlier when you showed the map, there was 700,000 members.
We have 700,000 members in county.
And how many employers does that represent?
1,800.
1,800. I think you did say
Just over 1,800.
Gotcha. Great. And the integration between yourself and Castlight, where does that stand in terms of that process? Is that complete, or is that still being worked on?
It's almost. So my understanding, and Peter can certainly jump in here, but my understanding is that by the end of the year, we'll be integrated from a perspective of that enrollment file, the ease in billing, the customer service, when you click our logo on Castlight's site, it would directly get you into the, do you qualify? Are you eligible to become a member? My understanding is that there's some final contracting conversation, bullets to hit, but we should be fully integrated by the end of this year.
Yeah, and I think the ultimate test on a lot of this is really how these programs really engages the employee from a retention perspective. So have your clients ever sort of correlated your results against their own retention of staff and engagement of staff more broadly in the workplace?
So that's a stat that we at Omada here don't have access to, the employers do. So I'll just take a page back from when where I just came from when I was at Blue Cross. We were doing studies with our group employers there, and we were seeing a lift in retention. But of course, this is a stat that employer groups have to maintain. So it was more anecdotal that we were seeing on the Blue Cross side, but we don't keep that stat here at Omada.
Gotcha. That would be a really good study to find some of your most satisfied customers to try to see if there's a proof point that you can add to your 4 reasons why clients are using you to make that case pretty hard.
Totally agree.
All right, we have no more questions in the queue, but I want to open this up and see if there's any last minute takers on questions, either through raise a hand function to speak or through a chat function. All right, well, we got a shy group today, but at least we've had a number of questions come through. So I'm going to just kind of wrap this up today. Thank you, Gabe. I hope everybody today has benefited by learning something new today about both Castlight Health and Omada. We've heard today how Castlight, helps improve employee well-being and obviously engagement retention through easier navigation of healthcare, which is very complicated, generating healthier employees and simplifying that entire experience. And now Gabe's also shared with us how Omada Health helps, improve employee well-being through dedicated care teams, through virtual specialists, personalized care, and then remote home monitoring technology to literally become the premier leader in multi-chronic condition management. As we wrap up today, I want to just remind everybody, we're going to send out a link to the ESA YouTube channel with all the presentations made today. Feel free to reach out directly to the presenters via the contact information in their presentations if you want to learn more, or let us know and we'll help connect you up. Anna, I went a little early, but I'm going to turn this over to you to help close us out.
No, this is terrific. Thank you so much. Yes, Art, I appreciate all of your help today. And thank you to all of our friends at both Castlight and Omada for being here and sharing with our network. And I think for the most part, Art went through my whole list. So look forward to seeing you guys at the next session, which is on September the 7th. And Regenix and Vivanta Health will be there, and when we might even get a little bit of personal experience testimonial from Art on Regenix. But anyway, thank you everyone for joining us. And again, you're welcome to pass the information that we're going to send out to you to everyone in your network and as well as your teams. Thanks so much, and everybody have a fabulous day.
Thank you all. Have a great day. Okay, little shyer group today, I think.
Oh, I was asking a lot of questions.
Yeah, you were. Yeah, it was just me. I
But
thought
it
Rick,
definitely was a quiet group. Even,
Yeah.
did we hear much even from
Rick didn't even ask the question.
Rick? I know, that's what I was just looking. I didn't think I saw anything from Rick.
Every time he was ready to ask the question, he saw Cindy ask it. That's probably what it was.
That's exactly what it was. Yeah, for sure.
Well,
Oh.
Cindy, what do you think about that? Do you
Oh
like
my
that?
God. So